is Lindsay. I'll be your nurse today. Can I get you to verify your name and birthday?
My name is Levi and my birthday is July 18th, 2013.
All right, thank you. Today I show you're here for a general survey and an assessment of your head and neck. Is that correct?
Mm-hmm.
If at any time you have any questions or you're uncomfortable, just let me know and I'll stop and we'll address those things for you.
Mm-hmm.
I seen when you were walking in that your gait was even, you were standing tall, erect, good posture, your mobility was good. I didn't notice any cane or assisted device. Do you use anything like that at home? Okay, and what about, is English your first language?
Mm-hmm.
Okay, and can you tell me who the president is?
Trump.
Okay, and what day of the week is it?
It's Monday.
And where are we located at right now?
Texas.
Okay, thank you. Very good. I was just checking to make sure you're oriented and know where we're at. And now, are you able to have 3 nutritious meals a day with meats, fruits, vegetables?
Mm-hmm.
Okay, good. I noticed on your chart your height, weight is appropriate for your age. Your BMI is right where it needs to be, so that's good. It indicates that your nutrition is well. Are you generally a happy person?
Mm-hmm.
And that's most days of the week?
Mm-hmm.
Okay. And I see that you are clean, well groomed. You have good hygiene practices, so we like to see that, especially in our younger patients.
Mm-hmm.
Now I'm going to go ahead and begin our assessment, checking your cranium, which is your scalp. So I'm going to go ahead and feel your cranium for any lumps or bumps. I'll look at your hair and your scalp as well. All right, here we go. I don't feel any lumps, bumps, irritations. Was there any tenderness when I was touching it?
No.
See, your hair is brown, it's clean, it's fine, evenly distributed. Your scalp looks clean, no dandruff, no infestations noted. Have you had any problems with any of those things?
Mm-mm.
Okay. And now I'm going to move to your face and begin your assessment, looking at your sinuses. So I'm going to place both thumbs on each side of your face at your eyebrows and then your cheeks. And I'm just going to push a little bit. You let me know if there's any tenderness.
Mm-hmm.
All right, first your eyebrows. Here we go. And then now your cheeks. Is that okay there? Okay. Look straight ahead for me. I'm just going to check your eyes to see if they are symmetrical. And they are, and even. I'm looking at your eyebrows. Close your eyes for me. And your eyelashes. They are even, no redness, drainage, or swelling noted. So that's good.
Mm-hmm.
Look straight at me. I'm checking both of your ears. There's no redness, swelling, drainage noted. Any tenderness? Right. Same thing with your nose. If you look straight at me. Okay. With your nose, it is symmetrical. No redness, swelling, or drainage noted. And your lips, they are pink, moist, and no drooping is noted, so that's good. I'm going to have you look at me, and I'm going to shine my light in your eyes, but just keep looking straight ahead. I'm just checking for your pupil reaction. Very good. And other side. Good. So your pupils open and constrict with the light as they are supposed to. So that is a good pupil reaction. Now for this next check on your eyes is for the accommodation to see how they adjust to changes in vision near and far. So go ahead and look over my shoulder for me and look at my light. Good. They reacted appropriately and quickly. And same thing. Once more, look at my light. Very good. So your pupil reactivity and accommodation are normal. Now I'm going to check your lymph nodes. So there's 10 areas that I will check, and I will touch them, and you let me know if there's any tenderness, and I'll also tell you which ones they are. All right, so right here in front of your ears, we have your periocular, auricular, and then behind your ears, we have your post-auricular, and then back here, or let's see, this is post, and then back here on the back of your head, we have your occipital. You'll just turn your head towards me real far, and to the other side real far. Very good, thank you. Look straight ahead. I'm gonna check your submental, and then on both sides, your submandibular. All right, we're gonna move over to right in here, and this is gonna be your jugulo-digastric right here, and we're gonna check your supraclavicular on each side. And if you'll just tilt your head towards me, I'm gonna check your deep clavicular, and tilt your head the other way. Same thing here, your deep clavicular lymph nodes. Head straight back up for me. And I'm checking your post-clavicular. I'm sorry, I said clavicular. That's your superior cervical, and your deep cervical, and your post-cervical. If you'll just turn your head this way so we can visualize that post-cervical, and to the other side. Thank you. And then now if you'll shrug your shoulders, I'm going to do your supraclavicular lymph nodes. So on each side, I'm going to check right above your clavicle. All right, you can relax. Are any of those tender, or do they all feel okay?
They all feel okay.
Okay, now I'm going to go ahead and check your trachea to make sure it's nice and centered. So look forward for me. I'm going to feel each side. Very good. It is centered and midline. I'm going to step behind you, and I'm going to check for your thyroid gland. So back here, and then now tilt your head and swallow. Good. And other way for me, and swallow. Good. That's nice, even, no masses noted. I'm going to feel the rest of your neck now, and just make sure there's no other lumps or bumps noted. All right. I believe that concludes our general survey and assessment of your head and neck. You can go ahead and have a seat, and I'll let the provider know that you're ready. Thank you. Hi, my name is Lindsay, ALVN, and I am reporting on a 11-year-old male patient who was seen today for a general survey and head and neck assessment. Patient was able to state his name and age and appeared healthy and of stated age. He was awake, alert, oriented ×4. He said he was able to have 3 nutritious meals a day, including meat, vegetables, and fruits. His BMI was within range for his height, weight, and age. He has normal gait and mobility with no assistive devices noted or verbally reported. His posture was straight and upright and no deformities noted. He speaks English as his primary language, and speech was clear, audible, and appropriate for his age. He is well groomed and with good hygiene and clean clothes. And starting with the assessment, we started at his cranium with no lumps, bumps, or irritations noted. His scalp was clear with no dandruff, redness, or infestations. His hair was brown, fine, and of even distribution. It was also clean. Then we moved to his frontal and maxillary sinuses, which were palpated with no tenderness. His eyes were symmetrical, and his eyebrows, eyelashes, and eyelids were symmetrical, no redness, discharge, or swelling noted. His ears were even, symmetrical, with no redness, tenderness, discharge, or swelling noted. His nose was symmetrical, no redness, swelling, or discharge noted. His lips were pink, moist, no discharge or drooping noted. And his eyes were reactive and appropriately accommodated to light and distance changes. His lymph nodes were palpated, all 10. His pre-auricular, post-auricular, occipital, submental, submandibular, jugulo-digastro, his superficial cervical, deep cervical, and posterior cervical. Also, his supraclavicle lymph nodes were palpable, non-tender. His trachea is midline and nice, within normal limits, and his thyroid was normal, symmetrical, and no tenderness noted. And this concludes my report on the 11-year-old male patient that I had seen today.